Germany, a country with a population of roughly 83 million people, is a country that is located in Western Europe. One-third of the country is covered in woodlands. You'll find that university is free in Germany, as well as healthcare. We'll cover a little bit more about that later on in the presentation. Germany is a country that truly puts their children at the forefront. Through healthcare, through education, and even independence, German parents always see their children as the highest priority. The principles of raising children differ considerably from the American counterparts, as does the healthcare system. There are substantial differences that will be noted in regard to pediatrics and general healthcare in Germany, and many of these practices may come as quite a surprise. Child rearing in the German culture is quite different than that of the American culture. American parents are often nicknamed things such as helicopter parents, as they tend to hover over their offspring, watching, analyzing, and choosing their child's every move for them. Americans are sometimes seen as overbearing, limiting the independence of their children. In Germany, this practice is not the norm, and it is culturally urged to allow your children to develop a great sense of independence, as to increase the likelihood of raising well-adjusted, independent societal adults. In Germany, the public transportation department holds the majority of the responsibility of moving children to and from school. The United States is accustomed to the state or county school systems overseeing transportation, but this is not the case in Germany. The thing that stands out the most about German parents in relation to transportation to school is the fact that a great deal of parents allow their children to ride their bicycles to and from school each day. Germans feel as though restricting autonomy of children voids them of a great deal of pride and self-worth. Germans feel as though teaching your child how to do something and watching them do it is a superb confidence booster. German parents pride themselves on establishing confidence and independence in their children at a very early age. So early, in fact, that it is not uncommon to see babies sleeping in their strollers while the parents dine at the window where they can see the child. German parents begin explaining the logistics of exactly where babies come from and how they got there to their children early, most often in elementary school. This conversation leads to an open dialogue between the parents and the children and establishes a manner of trust that is harder to attain when this conversation is held in the later teen years. Children are frequently becoming sexually active earlier in their lives, so the German parents feel that it is important to have a child that is well versed about sex rather than one blindly walking into the situation. The education system in Germany is overseen by the Federal Ministries of Education, Cultural Affairs, and Science. These organizations make decisions regarding science, education, and the arts, as well as adopting associated laws. Landers, which are German states, have more power regarding areas of school, academia, and the continuing education sector. There are 5 core levels of education in Germany. The early childhood sector, which covers children from 0 to 6. The primary, which is ages 6 through the completion of 4th grade. Secondary, which has 2 components: lower secondary education that consists of ages 10 to 15 or 16, and those kids are in grades 5th through the 7th or 9th through the 10th. Upper secondary can be considered for ages 15 to 16 to 18 if the child has completed lower secondary education. Tertiary, which is higher education for students who have completed upper secondary schooling. This is the American equivalent of college or universities, but are geared towards more of a trade, or what the American equivalent of a certificate, licensure, or associate degree program would be. The continuing education sector is for people who wish to continue their education at a higher level, starting with a bachelor's degree program and continuing on through master's degrees and doctorates, which are considered second and third higher degree education. German education is often aimed at growing and changing with the ebb and flow of current societal needs or demands. In 2014, Germany's 16 states abolished tuition fees for undergraduate students at all public German universities. This means that currently both domestic and international undergraduates at public universities in Germany can study for free. with just a small fee to cover administration and other costs per semester. Germany operates its healthcare system on the premise of universal healthcare. Universal healthcare is aimed at preventing and lessening financial strain and giving access to what people need, when they need it, and where they need it. It provides free care to all residents of the intended country without their obligation to pay. Universal health care is funded by the residents or taxpayers of the country through payroll taxes and standard income taxes. Germany is noted to have one of the least restrictive and patient-oriented healthcare systems globally. In 2019, Germany was ranked 6th of 33 national healthcare systems. Often seen as expensive and vulnerable to collapse, the German healthcare system appears to be thriving as of late. Universal health care with pediatric patients proves to be exceptionally beneficial, especially with children who fall ill of a chronic disease process. Diabetes is a good example of this. Management of diabetes can prove to be quite expensive, especially when you factor in the rising cost of medications and the frequency of physicians' visits. For pediatric patients with type 1 diabetes, the norm is frequently an insulin pump with a continuous glucose monitor, which is quite costly. Universal healthcare covers the majority of insulin pumps, which total around $4,500 along with the supplies, which average out at approximately $1,500 per each year. As an average, most Germans marry in their early 30s and begin growing their families shortly thereafter. The median age for marriage is 30 years old for women and 33 years old for men. Out of all European countries, Germany ranks at 8th in average of marriage. The total number of marriages in Germany are trending upwards recently, which is due in part to the allowance of same-sex marriages in the country. Legalized in 2017, same-sex marriage has seen nuptials grow upwards of 20,000 times, thus increasing the percentage of married Germans. With the passage of the right to legally marry for same-sex couples, also came the right to adopt children. This enactment has allowed for the enhancement of the lives of many children in Germany. The standards of dating in Germany are slightly more stringent than what we are accustomed to here in the United States. In Germany, people tend to date within their own social circles, not wanting to explore outside of a group of friends that they have harbored for years. In many other cultures, the standard is to date multiple people at one time before making an exclusive commitment. However, this is balked at in the German culture. Dating is more meaningful in Germany than it is in many other Western cultures. Germans have a certain set of unwritten rules for dating that they expect their counterparts to abide by. Things such as the following are held in priority: punctuality, straight talk versus flirtations, honesty, gender equality, and taking things slowly and investing time into really knowing a person. It will often take Germans months of dating before they become official with their new partner. At a recent review by the Human Rights Council, Germany was encouraged to bolster its gender equality, as females currently do not fare as well as their male counterparts in the labor market. Even as of 2020, women do not share in equal pay or career prospects. It is common practice in Germany for the female member of the household to carry the majority of the domestic workload. In addition to bringing income into the home, women continue to maintain a minority in decision makings, and the Human Rights Council voiced their intent to continue pushing for German women to be granted equal rights to that of their male colleagues. A topic often debated in Germany is that of refugee children, more specifically, the assimilation of immigrant children into society. All immigrant children that come to Germany come with guaranteed integration, which in turn comes with free medical care. The difference in healthcare systems between the immigrant's home country and Germany is always home to misunderstanding. Understanding requires education, effort, and the willingness to understand from all parties. There has been an influx of pediatricians in Germany who are well versed on multicultural thinking. Germany also boasts a large number of well-integrated pediatricians who work diligently to close the gap between immigrant integrating families and the healthcare providers. Many things must be taken into consideration when speaking of the healthcare needs of immigrant children and the differences in the country of origin in Germany. One must consider for the following issues when working to develop an understanding and a fit healthcare plan for the immigrant child: mental health issues, educational and developmental levels, ethnicity, culture, age, socioeconomic status, religious beliefs and practices, sex, and political beliefs. Turkish, Russian, and Polish children compose the majority of immigrant children, coming in at 14% for Turkish, 9% for Russian, and 7% for Polish.